Hello, dentalunboxing.com subscribers. This is Tim Kosinski, one of the clinical evaluators with dentalunboxing.com. Thanks for joining me today for another dental product unboxing and clinical evaluation. So let's get to it. Today I'm unboxing and going to clinically evaluate in my practice a product from WAM located in France called a Wamkey, which is used for crown and bridge removal. It's an amazing instrument that we'll demonstrate in a few minutes, but you're going to get a package, a little FedEx package that we will open. Let's see what's in here. It's like Christmas all over again. Wow, okay, cool. So we have, looks like we have a demonstration model, which is pretty awesome. And then we have a demonstration instrument of the Wamkey. And then a little model here that will demonstrate how to use the Wamkey. Here's the packaging. It comes in a nice case, and it has a video with demonstration, some directions, and it's simply a series of 3 instruments of various sizes, 1, 2, 3. And these instruments, if you take them out, you'll see are very high quality material, and there's a little metal ball at the end of them of varying sizes. Small, medium, large. So let's just show you how it works. You can watch the videotape anytime to get more information. But when we have a tooth, how do you now remove a crown? Well, I'm assuming that most of us would take some type of burr, and we would go from facial to occlusal to lingual, and then take some type of separating instrument and rotate, and then half the crown would come off, and then we'd take some other instrument to get the other half off. It's time consuming, especially with our new zirconia crowns. It's very time consuming, and those burrs are very, very expensive. But with the Wamkey, great instrument, what I will simply do is I will make a little elliptical opening in the occlusal or incisal third of the tooth. Obviously, I can't see where the preparation is in underneath a crown radiographically, so I'm assuming though that it's going to be in the occlusal third of the crown, meaning that the tooth had to be prepared a certain way. So I'm simply making a simple elliptical opening through the crown. Then I'm going all the way to the central groove area. So demonstrating here, if I was going to make a little elliptical opening, I want to drill all the way through to the central groove area. Once I make that small opening, I'm going to take my instrument, we're going to demonstrate, and I will simply place it into the site, and with a simple rotation of my wrist, the crown will come off very easily. Very, very time-saving application. Excellent way of treating our patients. Now, you now have a crown that's basically intact, and you or your team can certainly use this as the transitional or temporary crown while you're making the final prosthesis. So just a great instrument. I am excited to clinically evaluate and document this product in my practice for dentalunboxing.com. We have a mandibular first molar tooth that is deemed non-restorable. We have a vertical fracture in the furcation area, and the patient has symptoms. So we're going to remove this tooth in preparation for a future dental implant. We're going to remove this crown. Now, conventionally, to remove a crown, you would take some type of burr and section the porcelain and metal on the facial aspect, onto the occlusal, onto the lingual, then take some type of instrument to separate the mesial and distal part of the crown and remove the tooth, thus destroying the crown, which is fine. You go through a lot of burrs that way. But here we want to demonstrate a little different technique. The Wamkey is a series of 3 instruments, and you can see the shape of it. There's a little ball, so to speak, on the end. And we're going to use this ball to remove the crown without sectioning the crown in total. So you can see the unique design of the instrument. And what we want to do is we're going to make a preparation onto the facial aspect of this crown, a small elliptical hole, so to speak. And we're going to penetrate through to the occlusal table.
Now, the question you may have is, well, where's the preparation? You don't really know where the preparation is, but we assume that the preparation of this crown is on the occlusal 1/3 of the crown. So I'm going to make an elliptical opening in the facial aspect of this crown so that I can place the ball of the Wamkey through that little hole onto the occlusal table by the central groove area and then simply rotate that crown off. This is a wonderful system even if we weren't going to remove this tooth, if we were just going to replace the crown. It's very, very innovative and allows us to use this crown as a temporary in the future, which saves a lot of time. It's also wonderful for our new zirconia crowns or Bruxer crowns. In trying to remove those can be very difficult. So making a small opening, as I'll demonstrate in a moment, is pretty innovative. So you can see we're going to make an opening in the facial aspect, and to do that what I did is I just made a little marking to show you approximately where I want to prepare the facial aspect of this crown so to be able to put the Wamkey ball into it and remove the crown. So I just did a little marker there to show you what I need to do. I'm taking my high speed with a burr and I'm making an elliptical opening through the porcelain, through the metal, onto the occlusal table, or where I perceive the occlusal table of this tooth to be present. We'll go all the way through, and you can see it's just a small opening. And again, if we were just going to re-prepare this tooth, it would be quite easy to use this old crown as our temporary restoration and just cover that hole with a little composite material. So I'm taking my Wamkey, I'm just placing it through the little hole onto the occlusal table and then just rotating my wrist, and almost like magic this crown pops right off.
Hi, DentalUnboxing.com subscribers. This is Tim Kosinski. I completed my clinical evaluation of the Wamkey from WAM. So let's summarize 5 main factors I considered. Number 1, did the product save me time? Well, I thought it was an amazing instrument. Number 1, removing crowns is hard. How do we do it? How do I do it? I would take a burr. I would cut from facial to occlusal to lingual. I would take some kind of a separator. Usually the distal part comes off and then I have to try to get the mesial part off. It's a pain. And especially with the new zirconia or Bruxer crowns, they take a lot of time. We're using fine diamond burrs. It's an inordinate amount of time. And time is money. Chair time is money for us in practice. So using this instrument, it was kind of amazing. I simply made an elliptical opening on the occlusal third. I kind of had to guesstimate where the preparation of the tooth would be. I made a small elliptical opening through the crown. If it was a Bruxer, again, a lot easier to take a fine diamond with a round fine diamond and go through the material, through the porcelain and metal or zirconia, and I extended into the central groove area. Then I took one of the 3 Wamkey instruments, which are high quality metal with a little ball on it. I put it in and I simply rotated my wrist and magically the crown came off. So it saved me a lot of time. And then it also saved my assistants a lot of time, because if I were saving the tooth and I was going to re-prep it, I could actually use that existing crown as my transitional or temporary crown and just fill it with acrylic or composite material. And it's a wonderful temporary or transitional crown. What else? What's the simplicity, difficulty to integrate it in my practice? Well, when I first used it, I go, what is this? But it's really an amazing thing. It was simple to use. Again, realizing that I have to guesstimate where the preparation of a crown is to remove the existing crown, but I'm assuming it's in the occlusal or incisal third of it. But simply taking a burr and cutting through the porcelain, metal, and or the zirconia was simple as anything. And then simply taking the instrument, rotating my wrist again, the crown came off. Product cost, you know what, I'd pay a lot more money for this product because it saved me so much time. Our burrs are very expensive to remove crowns, especially our fine diamond burrs. They're very expensive. So this is an incredible savings because it's saving me a lot of time and saving me the cost of my burrs to remove crowns. My current technique, as I mentioned, how do I do it now? I would take a burr and go from facial to occlusal to lingual or palatal. Take some kind of separator and remove it and do the best I can, destroying the crown. So, no question, being able to make a small opening in the crown, removing the tooth with very little pressure, saves me a tremendous amount of time. I think this is a incredibly better product to use than our conventional techniques to remove crown. Would I purchase it and use it in my practice? I did. And actually, I think I'm going to get another set because we use it so frequently. It's just a wonderful instrument. So I give the Wamkey, our dentalunboxing.com, a golden tooth and would highly recommend it to any of my colleagues out there based on my review. Again, thanks for watching today, and please hit the subscribe button to get notification on new videos posted anytime soon.